Pfizer expanding its vaccine testing in kids younger than 12, the last group without approval.
Yeah, one pediatric doctor says it could do wonders for the nation's stagnant vaccine numbers. On Tuesday, Pfizer announced expanded testing of its COVID-19 vaccine in kids 6 months to 12 years old. The new study includes 4,500 participants in that age range with hopes that the shots could be ready for them by this fall.
First of all, our pediatric population makes up approximately a quarter of the population in the United States. So an absolutely huge part of the population.
And also a highly interactive group, says pediatric specialist Dr. Rosemary Olivero with Spectrum Health. Between school and extracurricular activities, while kids were less likely to suffer severe symptoms if they caught the virus, they certainly played a big role in spreading it.
So because we know that children can get and spread COVID, maybe not quite as efficiently as our older children and adults, but they still absolutely can. And we see that, in March and April of this year, children made up the majority of the COVID-19 infection.
Dr. Olivero says this last group of the population is especially important because as long as the virus has a potential host, it can change and mutate and stick around. And she points to preliminary data that shows 10% of kids who contract COVID-19 deal with some kind of long-term health effect.
Whether that be neurologic things like brain fog, poor functioning, not able to process things as rapidly, weakness, and there's other things about cardiovascular health. So COVID-19, unfortunately, yes, for the acute illness, most children do not get seriously ill, but for about 10% of them, having these long-term issues to have to grapple with, I think is really important for us to understand.
The vaccine itself is the same, but while adults and teens receive 30 microgram doses, for this trial, kids 5 to 11 will receive 10 micrograms and 3 micrograms for kids 6 months to 5 years. What would you say just in general to parents who are hesitant, have some trepidation about getting their kids the vaccine?
I do recommend that folks use a little bit of rational thinking when it comes to that. The safety data for the mRNA vaccines have been extremely promising and extremely effective in terms of preventing COVID disease.
And if we just take a little bit of a deeper look at where we stand right here in Michigan in that age group, so far more than 328,000 teens 16 and older have been vaccinated with either their first or second dose. About 123,000 kids between the ages of 12 and 15 years old have also been vaccinated with their first or second dose. About 7 million teens all across the U.S. Well, over on the east side, Henry Ford Health is also currently testing, they are a testing site for Moderna's vaccine in kids 6 to 11 years old.